Good day, everyone. We're going to explore one of the most common and significant aspects of musculoskeletal medicine, the bone fractures. We'll uncover the various types of fractures, what causes them, and the steps to take for proper healing and recovery. Whether you're a medical professional, a student, or simply someone curious about how our bodies work, you're in for an informative journey. So, let's start by breaking down the intricacies of bone fractures and discover the amazing process of healing and restoration. Grab your notepads or simply sit back and enjoy this insightful journey into the world of fractures. What pops up in your mind when you hear the word fracture? Maybe you think of a broken bone or crack in a bone perhaps. Well, you're right. A fracture is a partial or complete break in the bone. A bone fracture happens when something hits your bone with enough force not only to damage it, but to break it in at least one place. Healthy bones are extremely resilient and can withstand surprisingly powerful impacts. However, under enough force, they may crack or break. Physical trauma, overuse, and health conditions that weaken the bones are the leading causes of bone fractures. Other factors can also increase an individual's risk of sustaining fractures. A person's bones will typically weaken with age, which increases the risk of them breaking. As a person ages, the likelihood of their developing a condition that weakens the bones is also greater. Symptoms of a fracture vary depending on its location, a person's age and general health, and the severity of the injury. However, people with a bone fracture will typically experience some of the following: pain, swelling, discolored skin around the affected area, protrusion of the affected area at an unusual angle, inability to put weight on the injured area, inability to move the affected area, a grating sensation in the affected bone or joint, and bleeding if it is an open fracture. Fractures can occur in people of all ages, but certain factors can increase the risk of fractures. Here are some group of individuals who may be prone to fractures: elderly individuals, postmenopausal women, athletes, children and adolescents, individuals with certain medical conditions, individuals on medications, people with a history of fractures, malnourished individuals, and smokers and heavy alcohol users. In ancient times, the treatment of fractures was quite different from modern medical practices. The methods and approaches used varied across different cultures and time periods, but some common techniques and remedies included immobilization, traction, herbal remedies, setting bones, massage and manipulation, natural materials, rest and elevation, and the knowledge passed down orally.
Moving on, I will discuss to you a bit of knowledge about a certain deficiency that causes fragile bones and leads us more prone to bone fractures. But before that, what what is the meaning of deficiency? The meaning of deficiency is the quality or state of being defective or of lacking some necessary quality or element. Next, we are moving to the deficiency that I am pertaining to, the vitamin D deficiency. Vitamin D plays a crucial role in maintaining bone health by helping the body absorb calcium. When there's a deficiency in this vitamin, the body can't absorb enough calcium from the diet, leading to decrease in bone mineral density. Vitamin D deficiency can result from inadequate sun exposure, a diet lacking in vitamin D rich foods, or certain medical conditions. Vitamin D deficiency can contribute to the development of osteoporosis and osteopenia, conditions that weaken bones and increase the risk of fracture. For the next part of the discussion, let us be familiarized with the different types of bone fractures that will be discussed by my groupmates. First is the spiral fracture.
Spiral fracture. A spiral fracture is a type of bone fracture characterized by a helical or twisting pattern along the length of the bone. Unlike a simple transverse fracture, where the bone breaks straight across, a spiral fracture occurs when a rotational force is applied to the bone. This can be caused by a twisting motion or a torsional injury. So yung mga nakakaranas po ng mga gantong fracture is sa mga car accidents, sa mga athletes, sa mga sports like basketballs, volleyballs. Spiral fractures are often seen in long bones like the femur, thigh bone, or the tibia shin bone, and can result from various traumatic events such as car accidents, falls, or sports injuries. The spiral pattern distinguishes these fractures from other types.
So let's proceed to comminuted fracture. Comminuted fracture is a type of bone fracture characterized by the bone being broken into 3 or more fragments. Ito po yung crush bones, okay? Comminuted fracture, nangyayari ito because of the result of high energy trauma such as car accidents, fall from significant heights, or severe sports injuries. Example is, 'di ba, sa sobrang bilis mo po magpatakbo and then bumangga ka. So, yung trauma, yung trauma po, sa lakas po ng impact niya, na-crush yung bones mo. Yun po yung tinatawag natin na comminuted fracture.
Transverse fracture. A transverse fracture is a type of bone fracture characterized by a horizontal break that occurs perpendicular to the long axis of the bone. In other words, the bone snaps straight across. Transverse fractures typically create 2 separate bone segments, with each fragment having a straight edge where the fracture occurred. So yung mga nakakaranas po yung gantong fracture is yung mga nahuhulog sa mga matataas. These fractures can result from various causes, including falls, direct trauma, and other injuries. The location of the fracture can vary, and transverse fractures can occur in different bones of the body.
Next, let's proceed to compression fracture. Compression fracture is a type of vertebral fracture that occurs when one or more of the bone in the spine or vertebrae collapse or become compressed. Yun yung nagdikit po. Compression fracture can occur in any of the vertebrae in the spine. Pero most common po siya sa thoracic or specifically in the upper and mid-back. And then sa lumbar region po, yung lower back. Let's proceed to green stick fracture, This fracture is also known as incomplete fracture. Green stick fracture is a type of bone fracture that occurs in children. Lalo po ito sa mga bata na nagde-develop pa lang yung mga bones. So, this fracture is called green stick because they resemble what happens when you try to break a young green tree branch wherein it bends and partially break but doesn't completely snap, okay? Green stick fracture, the bone is bent and partially broken, yun nga po but doesn't break all the way through.
Closed fracture. A closed fracture, also known as a simple fracture, is a type of bone fracture in which the broken bone does not break through the skin. In other words, the bone remains contained with the body without an external wound or open injury. Closed fractures are typically less complicated to treat than open fractures, which involve the bone breaking through the skin and potentially leading to a higher risk of infection and complications. Treatment for a closed fracture usually involves immobilizing the bone, often with a cast or splint, to allow it to heal properly.
Impacted fracture. An impacted fracture is a type of bone fracture where one end of a broken bone is driven into the other end. In other words, the bone fragments are jammed together. This often results from a high energy force or trauma, such as a car accident or a fall from a significant height. Impacted fractures can occur in various parts of the body, but they are more commonly associated with long bones like the femur, thigh bone, or the tibia shin bone. The impact can cause the ends of a fractured bone to wedge into each other, preventing further separation. This can be painful and result in significant trauma to the surrounding tissues.
Colles fracture. A Colles fracture is a specific type of wrist fracture that involves a break in the radius bone, one of the two long bones in the forearm.
Oblique fracture. An oblique fracture is a type of bone fracture characterized by a diagonal or angled break across the bone shaft. Unlike a transverse fracture where the break is straight across the bone, or a spiral fracture where the break is twisted like a corkscrew, an oblique fracture creates an angle or slant in the bone.
In my part, we will be talking about the path and the open fracture. So let's start about the open fracture. An open fracture is a broken bone wherein it penetrates through our skin and exposed to the external environment. This is contrast to a closed fracture where the broken bone breaks but hindi siya nakikita sa skin. So, kunyari, itong kamay ko is may fracture. Then, yung bone po na nadurog is lumalabas na siya through my skin. So, nagkakos siya ng pagkasugat. Then, yung sugat po is nakadepend sa severity ng mga accident. So, an open fracture, nakikita na po dito yung bone sa labas ng ating skin. So, it is contrast to closed fracture naman, wherein ang fracture po ay hindi nakikita sa labas ng skin. So, kunwari, durog lang yung bone natin sa loob, pero sa skin natin is wala kang makikitang sugat, like, namamaga lang siya. So, that is closed and open fracture. Open fractures are typically classified into three categories based on their severity. First, we have type 1. Type 1 open fracture. The bone protrudes through the skin but it may not be extensively damaged or contaminated. Soft tissue injuries are minimal. Second is we have type 2. Type 2 open fractures involve a more significant wound with damage to surrounding soft tissues. However, they are still considered potentially manageable without excessive contamination or severe crushing of the bone. Lastly, we have type 3. Type 3 open fractures are the most severe. These fractures often result from high-energy trauma and involve extensive damage to the bone, surrounding soft tissues, and potential contamination. They may include severe crushing injuries and are challenging to manage. A pat fracture, also known as Spatz fracture, is a specific type of ankle fracture that typically involves the lower ends of both the tibia and fibula. Pat fractures can be the result of severe trauma such as car accident, fall, or a high-impact sports injury. They are often associated with significant pain, swelling, and deformity of the ankle. Prompt medical attention is crucial to assess and manage the injury properly.
When dealing with bone fractures, appropriate interventions are crucial to ensure proper healing and minimize complications. The specific intervention may vary depending on the type and location of the fracture, but here are some general steps to consider. Number 1. Immobilization. Stabilize the fracture by immobilizing the affected limb or area. This can be done with a splint, cast, or brace. For more severe fractures or dislocations, consider traction, external fixation, or internal fixation with surgical hardware. Number 2. Pain management. Administer pain relief medication to manage the patient's discomfort. This may include over-the-counter pain relievers or prescriptions medications as prescribed by a healthcare professional. Number 3. Elevation. Elevate the injured limb if possible to reduce swelling and minimize pain. Keep it elevated above heart level. Number 4. Ice. Cryotherapy. Applying ice or a cold pack to the injured area can help reduce swelling and relieve pain. Use a cloth or towel as a barrier to clip direct skin contact with ice. Number 5, wound care. If there's an open wound associated with a fracture, clean it gently and cover it with a sterile dressing to prevent infection. Number 6, surgery. In some cases, surgical intervention may be necessary, especially for complex fractures or fractures that have broken the skin or compound fractures. Surgery may involve setting the bone and using pins, screws, plates, or rods to hold it in place. Number 7, physical therapy. After the initial healing phase, physical therapy may be recommended to restore strength, flexibility, and function in the affected area. Number 8, follow-up care. Regularly monitor the fracture's progress through x-rays and follow-up appointments with a healthcare provider. Ensure that the patient follows any prescribed activity restrictions and rehabilitation exercise. Number 9, nutritional support. Adequate nutrition, especially with a focus on calcium and vitamin D, is important for bone healing and overall health. Number 10, of course, the pain management. Continue to manage pain as needed throughout the healing process. It's important to note that the specific interventions and the timeline for treatment will depend on the type and severity of the fracture. Healthcare professionals such as orthopedic surgeons are best equipped to make these determinations and provide appropriate care.
That's all for Group 2. Thank you for watching.